Gas prices shot up by 14 cents in the past 2 weeks. The national average price for regular gas now sits around $2.64 a gallon. The price at the pump has climbed 46 cents since November of last year. And according to the Lundberg survey, prices will likely continue to rise as crude oil costs remain high. The current price is also 11 cents more than it was this time a year ago. Since the start of the pandemic, we've had many shortages: paper products, coins, and even yeast. You can add aluminum to the list. Economists say the can crunch is caused by a change in drinking habits during the pandemic. People are consuming more things in package form and stopped drinking at bars and restaurants as much. Small brewers are hit hardest by the shortage, and the crunch isn't expected to end until the pandemic does. As the COVID-19 pandemic drags on, frontline healthcare workers continue to perform the impossible, asked to work more hours and care for more patients than ever before. NBC's Izzy Gutierrez explores the burnout and its impact.
For almost a year now, our frontline healthcare workers have been pushed well beyond their limits, often forced to make impossible choices.
We made decisions on who would live and who would die. In the emergency room, we're taking care of 11, 12 patients at a time when you really should be taking care of 4 or 5. You're allowing people to remain in a suffering state because you simply can't get to them.
The feeling of helplessness, overwhelming.
I could literally cry talking about it. But I knew at some points that this 87-year-old grandma who might have the biggest loving family at home, I knew she was coming to this hospital with the coronavirus and, ultimately dying alone.
All this, coupled with chronic understaffing and a lack of institutional accountability, is what some nurses say leads to burnout.
I am not a robot. I am a nurse.
A Penn LDI study that looked at hospital understaffing in New York and Illinois found that, quote, each additional patient per nurse was associated with significant increases in the odds of nurses reporting poor outcomes, including job dissatisfaction, intent to leave their job, and high burnout. And in many hospitals, all of that is already happening.
I personally have lost at least 6 RNs over the last calendar year. And some RNs I know personally that have left bedside without even a job lined up.
Simon Tang is one of those nurses, leaving his job at a New York City hospital after more than a year there.
The worst part is that we were just consistently critically understaffed. I just felt like I was reaching a point where I was getting frustrated at work, where I wasn't giving the best care I could, and where it was just becoming toxic for me to go into work, continue working under those conditions. So I made the decision to leave.
At times, the situation is so dire for these nurses that they choose to protest their assignment, meaning that they physically carry out their duties, but document that they do not feel they can adequately complete their jobs.
Think about that, a profession where you have to fill out something every day that says you're protesting your assignment, because it's sort of sharing liability. Look, I know I can't do this job right, so I'm filling out this form to let you know I can't do this job.
The physical and mental toll of the pandemic has left nurses forever changed.
I'm trying to come to terms with all that we've gone on, but that's just something that a lot of us will never forget, what we had gone on. PTSD is real in some of us.
So what do? Do you shut it out? Do you take it home? Do you become a different person?
But it's also pushed them to fight for a better future for nurses to come.
I think there are some people that really want to be nurses, seeing what we did and feeling really proud. I think that we can't lead them into a shiny path and then they walk into a hell. We want to make sure that they understand that we're going to do everything that we can to make this profession meaningful and that they'll have the tools that they need to practice the profession.
Bison football is back. Devin Fry will have scores and highlights coming up after the break.